The coronavirus is mutating. Is the vaccine safe, and when will life finally go back to normal? Dr. John Bradley, Medical Director for Infectious Diseases at Rady Children's Hospital, he just got his vaccine and gives us a look inside the next few months. You guys were on the news all last week. I said, oh my gosh, it's here.
We have such an efficient, wonderful group of people who are organizing vaccine acquisition from the county and distribution. We've got over 2,000 healthcare workers here immunized so far.
And you're one of them.
And I'm one of them. I'm so happy. I'm one of them.
I am so happy to hear the progress. And before we get started on all this, thank you again, because in the past several months, you have sat down with me every few months just to keep answering our questions, because there's so much unknown. And you've helped us work through it and figure it out.
Your questions are so good, and you allow me to explain what we know and what we don't know. So most of your questions just don't have a yes or no answer. And so being able to explain things to you and why we have this opinion now and why it changes is so valuable to me. And I appreciate your giving me this opportunity.
Well, I appreciate your time. And here's my first question.
Yes.
You got the vaccine.
I did.
Why are you wearing a mask?
Several reasons. First, I just got the vaccine a week ago, and based on how the clinical trial was done, I won't be officially protected until 1 week after my second dose. And with the Pfizer vaccine, the second dose is 21 days after the first dose. So technically, I could still be contagious, Shally, and there's no way I would want to infect you or anybody else. So I'm continuing to wear my mask. And then, even when I'm fully protected, for me to take off my mask could give people the impression that I don't care anymore. And they don't know if I've been immunized. There's no marker on me. And so to let people know I'm still believing strongly that masks will prevent spread, even though I probably won't be spreading it, I'm going to still be wearing my mask until 70% of the people in the community are immunized or have had the infection, and we have herd immunity, and the virus will stop spreading.
Which brings me to my next question. It's just probably the golden question that everybody is asking. When are we going to get there?
As you know, different people are making different predictions. And it's all based on how quickly vaccine can get to the population. And not everybody in the population needs to be immunized. The modelers predict if there's 70% immune, then if the virus is introduced, someone flies from Europe or somewhere and has the virus, it will not continue to spread in our area. And that's critical. So when will 70% of the people be immunized? And that depends on vaccine production. We've got 2 vaccines. Who would have ever guessed that both vaccines would be authorized by the FDA? Who would have ever guessed that they're both 95% effective and that the safety profile of this is great, other than a sore arm and aches just like you get with the flu vaccine? At least for the 40,000 people in the Pfizer trial, 20,000 of whom got the vaccine, and another, about 30,000 in the Moderna trial, 15 of which got the vaccine. 2-month follow-up data, there were no long-term adverse events. We're tracking it. Everybody in those studies, all those thousands of people, signed up for a 2-year follow-up.
Wow.
So the FDA and the companies are collecting information to see if there's more long-term issues with the vaccine. We don't know of any. We're not aware of any. But you never know. Something might pop up, and we're there tracking it. So safe vaccine, effective vaccine, and then when do we get 200 million doses in the arms in people in the United States? And the manufacturers are working as fast as they can, but they've got the FDA high standards, production, there's quality control, these have to be effective vaccines, storage has to be great, sterility has to be great. Everything that you expect of an injectable vaccine, all those criteria have to be met. So you can't just like produce 1 million doses overnight. It's a production. And the FDA inspects all those factories so to make sure that everyone's compliant with all the quality standards. So some of the projections are by spring, by late spring, so March, April, May, the number of vaccines that need to be produced will be produced, and it's a matter of getting them in the distribution networks. So we believe by late spring or summer, we will meet that 70%. So July 4th, Shally, if you want to plan on having a party with your mask off, I'm predicting July 4th will be a good date.
Let me arrange a DJ, and then I think my first party, I've said it out loud, is going to be a hugging party. It's going to be called a hugging party.
Absolutely.
I want to go back to the vaccine,
Okay.
Because you got it, and I still talk to many, many people, even some in the medical community, who have shared their reservations, their fear about getting the vaccine.
Yep.
Even though there was a new study that actually came out today that said now 71% of Americans are now saying they will get the vaccine, with the rest of them saying, I'll get it once I watch the other ones get it.
Yes.
For someone like you who has been in the medical field for many, many, many years, I can't imagine you would allow an injection to go into your arm if you weren't fully confident that this is safe.
Clearly, I wanted the vaccine, and clearly this vaccine looks to be safe and effective. But what we do is we balance the risk of getting the infection and what that does to people, especially in my age group, with the risks of the vaccine. So as I shared with you, the risks of the vaccine are minimal, and the protection looks to be very good. So I balance that with what is the community spread right now, and it's huge. Every time you walk outside of your house, you go to the grocery store, anywhere, you have a risk of having someone sneezing in your face if they're not wearing a mask. So to me, the benefits of the vaccine today far outweigh a theoretical risk that we're still tracking. So I wish I could tell you it's 100% safe and effective, but I've always been honest with you. I believe that's what will happen, but until we've got 6-month data, 12-month data, until 1 million people have been immunized, and the safety record in those first 40, 50,000 is replicated in 1 million, I can't guarantee it. And for people who want to hold off an extra month or two because they don't have exposure, these people who are working from home and don't go out much, maybe just to the grocery store once a week, their risk is pretty low. So if they wanted to wait a couple of months to see how the data come out, I think that's absolutely fine. It's a new vaccine, so there haven't been millions of people to have received these mRNA vaccines. So in that sense, it's not well studied. You look at flu vaccines, there's hundreds of millions of people who've been immunized. We know everything about that vaccine. This is different. So if you're out there, if you're being exposed to people every day, like you are, Shally, the risk of getting the infection, to me, as I would talk to you, is far greater than any potential risks from the vaccine. Does that put it in a perspective?
It does. For those who are considering to get it, one of the questions I actually had someone send in to me today, and they asked me to ask you, is if I get it once, do I have to get it again every year? Is it once a few years? What do we know about that, or is it still too early to know?
It's too early to know. This virus has just not even been in the United States for a year, so we're still learning. What is important and to know and is different about coronavirus, this coronavirus in particular, compared with flu, is that this coronavirus doesn't mutate rapidly. It mutates at a very slow rate because it has, within the virus itself, a proofreading mechanism when it creates new copies of itself. So if there are errors in copies of the coronavirus, it finds them, it kicks out that error, and so the virus replicates pretty faithfully. Influenza, on the other hand, doesn't have that kind of proofreading, and there's mutations all over the place. And if one of those mutations also happens to be contagious, bingo, we've got a new strain that's circulating that nobody's immune to. So this virus, we do not expect to mutate enough that you'll need annual vaccines, number one. We don't know how long-lasting the immunity is to this vaccine. And as we've been discussing, the studies only have tracked people a few months after their vaccine, 2 months for safety, the median time for safety, and 6 months for efficacy. So we know for the short term that they work, and we are tracking to see how long that effect works. So there are other viruses that we thought one dose would be fine, like for measles, and then all of a sudden there are these vaccine failures, and everyone goes back and goes, oh, maybe one dose isn't enough, and everyone gets together and says, we need another dose. So we're keeping an eye on that, and if there's a second dose that's needed, it will be because there are people who've been immunized who all of a sudden start getting infection in large numbers.
The kids.
Yeah.
How are they still doing with this virus?
Kids are doing great. The kids are doing great. You don't have to worry about your kids, Shelley. I am impressed. In the midst of this huge community outbreak, and adult hospitals are straining, we just have a dozen kids or so with coronavirus, and the ones that are sick are the teenagers who are basically adults, and some of those teenagers have risk factors that also occur in adults, like obesity, diabetes, and that sort of thing. So we're seeing adult disease replicated in the older children here, but the young kids, school-age kids, infants, toddlers, they do really well. They do, and we still don't understand why. But I am so grateful.
I'm grateful as well. I think I remember having a conversation with my husband saying, can you imagine what the state of our community would have been if this was affecting our children? I mean, it's bad enough with adults, but our kids are one of those that you just never want to see a child go through this. So that's good news.
But we don't want kids getting infected, because then when the parents and grandparents like me hug them, and it's hard, we've had this conversation before, it's hard not to hug your grandkids. We don't want the kids spreading it to the grandparents. And kids, many of them have no symptoms at all of infection. So you walk into a room and your grandchild is smiling and happy and no symptoms, and they run up to you with their arms open, and they could be contagious.
What would your advice be, Dr. Bradley? We went through the Thanksgiving. By the time most people will see this, we'll be past Christmas because we're so close to it, and we're heading towards New Year's. And there's people that are just COVID fatigued. They miss family.
Yeah.
This is the time of the year that we want to be around people. What would your advice be to people who are watching right now and they're making that decision, saying, no, it'll be fine, just like they did with Thanksgiving. It'll be fine. I'm just going to go see my family.
It won't be fine, Shelley. And Thanksgiving proved that to us. So many people got together at Thanksgiving, didn't wear masks. Huge spread through the community. Peaks of disease, peaks of hospitalization, and peaks of death. So what I hope you can share is that, especially for young people, they do really well. And if you tell a young person, you're not going to get sick if you get infected, but if you get infected and you contact someone else who's older or has a high risk factor for severe disease, you're going to be the one responsible for spreading it. So please wear your mask so that you not only protect yourself, but even more importantly, you protect those around you. And I think that's the critical thing during the holidays, is that think of other people around you, especially older people and people with cancer and people with all the, blood pressure problems or lung problems. Because if you inadvertently spread this to them, they could die.
If masks work and social distancing work, and we live in San Diego and we're blessed with this incredible weather,
Yeah.
is there a way to be able to sit in one's backyard, distance from others, and with a mask on, and maybe have a quick bite to eat and put your mask back on, sitting outside and
Yes.
have a lower risk to be able to?
Absolutely. So the ventilation, and we've had this discussion. If you're outside, it's nature's ventilation. It's spectacular. So the virus, as I'm talking, would waft in the air in an enclosed room like this. But if you're outside, the wind just blows that.
And it just goes away?
Oh, just away. It gets
Okay.
diluted out so fast. You need not only virus, but you need enough virus to land on you in order to cause a productive infection. So if you're outside and you're more than 6 feet away, technically the mask is not nearly as important as it is if you're inside. So inside the masks, outside 6 feet, much less important.
So there's a way to do it, but you really got to be mindful about your decision. So all these infections that we're seeing popping up are really people who maybe made the decision to get too close with the masks off.
Correct. And all, you could look on the county website, all of those dozens of exposures are generally in situations where just people weren't wearing masks. And they thought this is really important, and you bring this up. Well, I haven't seen these people for a while. I haven't partied for a while. I really enjoy getting together with my friends. And they'll say, well, I just won't wear a mask for a few hours and then I'll put it back on. And that's the mistake. You take your mask off and people are all around, especially if you're drinking and you get close and you start talking loudly, the virus spreads. We know this.
We've had a rush on people wanting to test for COVID in the county. We've been advised by doctors, CDC, saying please don't get together for the holidays. And the airport's telling us that there's record number of travelers moving during this time. Some say, hey, I'm going to get a test. And if it's negative, I'm clear to go to mom and dad's for Christmas, or I'm clear to go to mom and dad's for New Year's. Why doesn't that scenario necessarily mean that you can take a COVID test, be negative, and then go home for the holidays?
So the COVID tests, the nasal swab, lets you know if you have a current infection. If for instance, I had the infection, and heaven forbid I exposed you, if you tested at 3 days or 4 days or 5 days, you could be negative, but you could be incubating. And so the day you're tested, I can say you're not contagious, but the next day you could be contagious. And that's the problem with that test. It gives you a false sense of security. If you are boarding a plane, and I've heard some long haul flights are doing this, and you get tested as you board, it's probably safe for you to be on that flight. But a day or two later, if you're going to get on another flight, you need to be retested. And optimally, if you could test yourself every day for the 14 days after exposure, you would know if you got infected by that exposure. So, 10 to 14 days is the incubation period for this. So to your question, the test only tells you if you're negative at that one point in time, and not the next day, especially not 2 or 3 days later.
How's San Diego doing? And what do you think is going to happen over the next few weeks and months?
I'm so frustrated. We've got all the tools. We know what to do to keep the virus from spreading, but I think people aren't following the guidelines, and it's not everyone. There are a lot of people who are doing the masks. I am thrilled. You walk into the grocery store now, and everybody's wearing a mask. Everybody's respecting everybody. So there are pockets where there's full compliance, and we know that there's pockets of poor compliance. So in San Diego, we've got a lot of people who are not compliant, and that is causing the numbers for the entire county to go up. And one of our friends on the medical staff, who actually was training to be a chef before he went to medical school, and still, I understand, has connections with the restaurant industry, they're just dying because with the spread in the community, the restaurants are getting shut down. So his friend, the restaurant people, many of whom would love to open their restaurants, even to a limited extent, and would follow all those guidelines, because of the widespread infection rate in the community, it's like everything is shut down. So the few people who aren't recognizing what needs to be done are impacting life for everybody in the county, Sally. So if you could please tell those people to please wear their masks, and it'll help all of us get back to normal, I would be really appreciative.
We'll work on it.
Okay.
We're trying. Is there anything else that has developed new that since we last spoke?
So I did want to touch just for a second on mutations in the virus.
Yes.
Because you said how long would the vaccine be effective? Mm-hmm. And we've thought about that. We've thought about, if you got infected, how long do you have natural immunity? And as you remember, last June, there was a slight mutation in the virus that made it more contagious. And so that strain proliferated in our region. It was more contagious than the other strain. And I actually just yesterday went back and looked at some of our discussions and what was in the medical literature. And it appears that the same thing's happening now in England, in the UK. Around London, there appears to be an increase in a new strain that may be more contagious than the current strain that's circulating. So in that sense, people should expect there to be these newer strains popping up from time to time. But the way that the vaccines are created, your body makes a response to entire sets of proteins, all aspects of the protein. And these mutations cause just a little change in maybe a bump of one of the proteins that sticks out, just a small bump, but your body responds to everything else. So I don't want people to worry that, oh my God, there's a new strain, the vaccine won't work, I'll get reinfected. Don't want them to think that. I want them to think there will be mutations and that the vaccine is likely to still be protective, but everyone's checking that out, the FDA, companies, the CDC, just to make sure everything still works. But that's hit the news a lot just in the last few days. And the headlines are pretty attention-grabbing, and no one has shown that this virus is any worse in causing disease than the previous one. Just like in June, the new virus that was more contagious did not cause worse disease. So I wanted to reassure people a bit.
Thank you for doing that, because it can get kind of scary sometimes when you hear that, oh my goodness, and this. So we're good. We're still good.
We are still good.
Okay, I feel much better talking to you. I am anxiously waiting for my vaccine. I hope to get it. And my question is always, I come to you and I say, when are the kids going back to school full time?
Complicated question, and it's sometime next spring, but one of the things we want to do, we want to protect teachers because the kids won't be sick again, but it's the older teachers, especially teachers my age. So we've emphasized that the teachers can wear all of the stuff that we do in the hospital, all your protective equipment. I wear the whole everything to protect you from being infected. And also the teachers are in one of the priorities to get vaccine. And I think, Shelly, the teachers probably are in a higher priority than you.
That's okay.
I'm so sorry.
That's okay. No, don't apologize. Give it to the teachers.
Right, it's because they're out there and being exposed to kids. So I think once the teachers get immunized, and then the school districts, each of which determine whether their schools can open or not, will feel so much more comfortable with opening them. A lot of the schools, as you know, are open. And every school has its own plan for distancing and wiping down surfaces and plastic dividers between desks and all that sort of stuff. Some things really creative I've seen. So those have been implemented. Some schools have opened, other schools have not. Some schools have more resources than others. So, but to protect the teachers, I think that's probably a critical piece of the puzzle. And until teachers are protected, I think you won't find schools just opening up easily. And of course, if kids are protected, if they wear masks and they aren't all together on the playground jumping on one another the way they normally do, you won't spread the virus in schools. And so even when all of these rules are made, how to do recess, how to do classes, how you get into the school buildings, how you leave, how you go between classes. So and all these discussions have been ongoing. We want to make sure that once schools open, that they are safe. So even once they're open, there's plans now to track by doing testing of kids to make sure that someone with infection who has no symptoms doesn't come in and begin to spread it through the classroom. So a lot of planning that's going on.
A lot of planning, but I think the biggest takeaway sitting down and talking with you today, and thank you for your time, is that the light has never been brighter.
Yes.
That there is an ending to this and we can see it now.
The vaccine. The light are the vaccines, and there's more coming, as you know.
Yeah.
A few other virus vaccines are rushing to the finish line as well. So we may have hundreds of millions of doses of multiple vaccines. And then it won't be, gee, can I get a vaccine? It's let me guess, which of these 4 would I like? Which would be a miracle.
Thank you, Dr. Bradley, for your time.
Thank you so much, Shelly.
You've been listening to It Is What It Is with Shali Zomarodi. You can join in and ask your questions live on Shali's Facebook or Instagram page. You can find so much more by following Shali on Facebook, Instagram, Twitter, YouTube, and by visiting shalD.com.